And to do so, you need to leverage something that's painful. Lemke at Stanford School of Medicine discussing dopamine and some of the things in her book and some newer findings as well. And somebody in the audience asked her the question, does meditation increase dopamine? Now, earlier we talked about how non-sleep deep rest and yoga nidra has been shown in the scientific literature to increase dopamine. But I also mentioned earlier that classic forms of meditation, whether eyes open or eyes closed, so-called open monitoring or closed monitoring meditation, sitting there or lying there and focusing, does not increase dopamine levels per se. However, for most people, especially people who find it hard to meditate or who don't do that practice very often, meditation is effortful. Getting into meditation and staying in meditation is effortful. So if you find yourself in a state of procrastination, oftentimes a brief 5 to 10 minute meditation where you absolutely do not allow yourself to do anything besides close your eyes, focus on your breath, and when your mind drifts, get back to your breath, is not only extremely difficult and extremely frustrating, unless you're a well-practiced meditator, but it's often difficult and frustrating not just to do, but to get into that practice. And not just to get into that practice, but to maintain that practice for that mere 5 to 10 minutes, because it's just not a natural state for us to be in. We have to force ourselves. So it is effortful. In fact, it qualifies as a basically available almost anywhere, anytime type of effortful activity that if you dislike it, perhaps even as much as some people dislike deliberate cold exposure, well then perfect. You now have an additional tool in your kit that you can use anytime you are feeling amotivated and procrastinating.